Welcome to Facebook Live. I'm Dr. Annette Mercatante from the St. Clair County Health Department.
And I'm Justin Westmiller, the Director for Homeland Security and Emergency Management here in St. Clair County.
And we're here to answer your questions, so please send them in. And meanwhile, while we get started, we'll go through initially our data, and I'll get a few questions until we start seeing yours feed in. So our COVID cases, our status report is typically sent to you. You can see that we have close to 800 cumulative total cases. Overall, we have 48 new cases with an average of close to 7 new cases per day over a 7-day average. Our percent positivity remains under 3% at 2.8%, and our overall testing remains pretty stable. We've talked before about our demographics, our age distribution, and we are in fact seeing a younger population overall being diagnosed. Our graph shows the 7-day average of new cases since the onset of the pandemic in mid-March. You can see again the large initial peak, the decline, and then the increases after June. You can also see at the very end of that graph a flattening or even a reduction of new cases. And again, I would warn all of us, it's a little too early to hang our hat on that, but I am very optimistic that we are not seeing a steady increase in new cases as we were a few weeks ago. And actually our 14-day average new cases is showing some decreases. So the good news is we're in a pretty stable place as far as transmission of the virus goes. Our capability of testing has remained good. I wouldn't say robust, but we're testing over 200 per day, both through the health department and our various community partners. And with that testing, since the onset, we have a 5% positivity rate. But as I mentioned before, the testing in the past week has resulted in a 2.8% positivity rate. We have our list of clinical information. I'm sorry, is that there? Oh, we didn't put that down. We can talk about clinical symptoms. And finally, our dashboard, which is available 7 days a week, 24 hours a day at www.scchealth. I always want to say St. Clair County, scchealth.co, where you can see our daily updates. So that's our data for today. I think the big picture there is we're steady as we go. We're pretty much in the same place we were last week, and we're not getting any so far.
And on that, we are, one, thank you to the community. That means that you're doing the right things, like wearing masks where it's appropriate. You're doing what you need to do with social distancing, and all those things are going to continue to feed into keeping that percent positive low. Anything below 3% is where we need to be to keep things working in a positive manner. So thank you on that.
All right. Okay. So we'll go. Should I go to some questions that have come in over the week, and then we'll get to the new ones?
Yep. Great.
So I mentioned I'll go to the bottom and I'll work my way up because the bottom one's the simplest. The question is, what's the percent of positive cases that we're showing with 0 symptoms? In other words, asymptomatic cases. In St. Clair County, that's roughly about 14%. Out of all the positive cases, about 14% of them are reporting no symptoms at all. It's a little higher than the region, but you got to remember we're not having as much trouble. The rest of the region may be testing a lot more positive people with symptoms.
So one of the first questions that I have, and it's a big one for this week because we've got float down coming up on Sunday. What are the safety precautions that we would recommend for anyone planning to attend the float down in regards to COVID-19? Well, again, float down, potentially thousands of people in the St. Clair River leaving from Lighthouse Beach and arriving down in Marysville, off of the beach in Marysville. And you know, people are going to be getting into water that's below 80 degrees, somewhere around 76 degrees. You're going to be floating in the water for potentially hours. That we know can cause hypothermia and will cause hypothermia. Couple that with alcohol in a COVID environment, being close to many people and you don't know if those folks are COVID positive or not, without social distancing, no masks. it creates a dangerous environment, period. There's no question about that. So some of the things I'm going to ask you to do, and I know Doc will follow up, but have your PFDs. Everybody needs to be in a personal flotation device. You need to have things that you can help paddle yourself with, whether that's a paddle or some other device to keep you on the American side. You've already been warned many times this week and last week, don't venture off into Canada because they've got some pretty strict rules both with COVID and with crossing the border this year. Just don't go over there. If the weather is not good, don't join the event this year. We don't quite know what the weather's going to be. It's a little up in the air. But if the wind picks up, go in and get off the water. It's a very dangerous event. You're getting on a waterway where the water travels 6 knots down the river, 6 to 8 knots, which is about, 7 to 10 miles an hour potentially, and there's serious current issues. So if you're not a good swimmer, if you're not comfortable on the water, don't join the event. Normally it can be a decent event, but this year it's not the right time to go out there. So if you are going to go out though, make sure you have identification on you. Make sure you know how to get a hold of somebody to come help you, to retrieve you if you end up somewhere you shouldn't be. And understand that if you get out somewhere that's not appropriate, like if you decide to crawl on somebody's private property, you could be subject to arrest. So there's lots of negative things that that this year just makes it a really dangerous event. So be prepared for all those things.
All right, we have questions coming in from Facebook. First one, when will the cases instead of total cases?
When will the map that we send out once a week show current cases versus total cases? Probably never. And the reason for that is because I just said, we have an average of 7 or less cases per day, sometimes a little more, which means that there are generally individual cases scattered throughout the county. And when you have one case show up in a sparsely populated county, people know who that person is. So it's a way of revealing personal information that cannot and should not be revealed. I'll say another reason why we generally won't do this. And of course, if we have a huge outbreak and we want to show where hot spots are or something, believe me, we will do that. We look at hot spots every single week and we do not have any. We do not have any area of the community that has more COVID transmission than the other. And the reason is this. People don't catch COVID by being in a community. They catch COVID from each other by going places. So within a household, of course, but you're going to know if you're living in a household with somebody with COVID. You're going to know if you are in contact with somebody with COVID. So you don't need to guess that from a map that we put out. But if you're a neighbor of somebody with COVID, that's not information you need to know. You're not going to catch COVID from that individual down the street unless you want to hang out with them. Okay? So the idea is it's not really beneficial to you in any way. And number 2, it's a way of revealing personal health information that is not a good idea and something we don't want to do. So hopefully that answers your question.
All right, next question. Why do the rapid COVID tests have a price tag of $100 a piece? This is for employees to get back to serving food inside at our local restaurants.
So the question is, why do tests, and I would say all COVID tests, not just the rapid COVID tests, cost money, upwards of $100? I would say that's about right, what we're seeing. And that's because these tests are not free. The people who are making them expect to be reimbursed for them. And the federal government is not, in fact, subsidizing testing costs. So it is still up to the lab who's manufacturing the tests to get reimbursed for them. And so we know health insurance is required to pay for COVID tests. But if you don't have health insurance, we've got to look for other ways to do it. So at the health department, we get tests through a separate system, a COVID relief package through the federal government, and we try and provide those for you at no cost. But if you go to a provider of any kind, that provider has themselves had to either purchase the test and needs to be reimbursed, or the laboratory needs to be reimbursed for the test. Now, is it worth $100? I don't know.
All right, next question. Curious about elementary aged children. Should they start school specific if one has been diagnosed with epilepsy?
Okay, the school
Yep,
issue
this
is
is a big
such
issue.
a hot topic. So
Yep.
the caller or the question is, should a school, an individual child go to school with a specific diagnosis? And I do think that child's immune system and medical condition needs to be addressed separately between the parents and the healthcare provider to understand what that child's risk is. Because let's face it, when we go back into a face-to-face environment like a school, no matter what kind of precautions we take, the likelihood of having exposure to kids with COVID is going to be there. Pretty much like if you go to the float down, you're increasing your risk of having a COVID exposure, okay? So hopefully a school environment will be a little more controlled. We will be able to make sure sick individuals don't show up. We can be hopefully a little brisker in testing and making sure that we draw those parameters. But the risk to each individual has to be addressed, I think, individually between the caregiver, the parents, the child, and their healthcare provider. We do know that vulnerable individuals, people with more chronic health conditions, can have a more serious outcome with the COVID infection. So that does need to be brought into the equation.
All right, next question. Did you just call into the school board meeting and suggest this was the best time to open schools?
So there is obviously a lot of school board meetings going on right now. And that the fact is, I did call. I didn't say this was the best time. I said this might be one of the best opportunities because of our flat curve. As I mentioned before, when we look throughout the country and throughout the world, when schools have opened, we've been able to look at whether those school openings have resulted in dramatic increases in COVID cases. And in the situations where opening of schools has not resulted in dramatic community increase of spread, are when the community is already controlling the infection. Okay? If you have a community that's already stable with transmission and does not have a high rate of transmission, then the potential of opening a school and not adding to that large increase in cases is there. We are in that situation now. We are, in fact, in a situation where we've had several weeks of stability with a low rate of positivity. This could be a good opportunity to try this. It doesn't mean it's going to work. It doesn't mean we're not going to have to pull back. It doesn't mean that all virtual is a bad choice. I'm just saying that when you look at our data and you look at the amount of transmission we are in one of those areas where school opening and face-to-face education is considered a little bit more reasonable. I cannot promise anyone, nor can anyone promise you, that the situation will be better in 2 months or worse in 2 months.
And let me jump on that a little bit. So, a couple of things to remind our audience. Number one, this is a novel virus. So this has never been dealt with before in human history, number one. Number two, we are below 3% positivity rate, okay? So we've only done that in the time that Michigan, or in the time that our counties dealt with this, we've only been in this situation really one other time, and that was back in June, right?
When we were less than 5% positivity.
Yep.
And that 5% positivity is a standard that's being used by the World Health Organization and many other states as we look at what are the guidelines.
Many other countries.
What's the data that would guide us towards, yes, this is a reasonable option, or no, this is just kind of this is a recipe for disaster. And what I'm saying is right now our data would suggest it's a reasonable option.
So when Dr. Mercatante says this is one of the best times to take this opportunity, we're doing the best we can in a novel virus situation, right? And I think the boards of education and our school administrators are taking that information and making a judgment call and doing the very best that they can as well in a very uncommon and
There's something else to consider, though. So
And situation, yeah.
I'm referring purely to the epidemiology
Right, to
of
the
this virus,
science.
to the science
Yeah.
of what we know has been correlated with problems with opening schools and no problems. There are lots of other variables that need
Absolutely.
to go into opening a school. For instance,
that's
our
true.
toolkit from the governor states specifically things that are required. And quite honestly, all of our schools may not be able to meet those requirements.
And I was just about to get to that.
To do it. So my response is this is what our data is telling us as far as the time
The medical.
and the place
Yeah.
for the epidemiology. There are many other variables that the school boards and the schools need to consider: the cleaning capacity, the busing capacity, the screen. I mean, it just goes on and on. The desks, the space in the rooms. I don't think it's business as usual. And when I say go back to school, I am not thinking that going back to school the way we did last year is in any way a good idea. It needs to be addressed, and call it hybrid, whatever you call it. We need to go slow, and we need to be very careful, and we need to pay very close attention to what happens if we do this. But the epidemiology is in fact favorable to move in that direction.
And the other thing we need to remember is we must continue to remain very flexible in our school systems, and remember that there's a high potential, and you've said this a lot, for starts and stops, right? If we're gonna bring the children back into the school districts, remember that starts and stops are a high potential and high probability due to the way we've watched this virus go up and down.
And certainly nationally, that's what we see.
Absolutely.
Almost
Right.
all in the United States, we're not seeing a lot of schools opening up and staying open. There is a
Right.
lot of stopping and starting. So that's a given.
Yep.
That's a given.
All right, the next question. What is the waiting time for results through the health department for COVID-19?
Oh, that's a great question. What's the waiting time for test results for us? And I know I just asked that question at our hospitals today. They're at 36 to 48 hours most of the time. We're at about 48 hours to 72 hours, I would say, most of the time. It goes up and down depending on the volume the lab has. So hopefully we're getting them back in within 3 days.
All right. I noticed there hasn't been any new deaths listed in about a month. Are treatments improving, or is the virus weakening?
Neither. Well, take that back. The question is, the death rate is really but I think it's not because the virus is weakening. The virus is infecting a younger, healthier population. We see a definite shift in the number of positive cases in younger populations. We know the virus is most deadly in elderly people and people with chronic diseases. So that's number one, and I think that's really driving this probably more than anything. On the hospital treatment side, though, they're better at treating this. They're a lot better at understanding how to manage cases with COVID. They know what medications do and don't work, at least what's available to them. And in general, I think there's some life-saving things on that side. But the reality is they're not even seeing a lot of really sick people in the hospital either. Right now, the people who are getting infected are just not getting really super sick. And it's not because the virus is different, it's because the people who are getting infected is different. And if we keep it that way, that's good news. But the problem is the virus doesn't really care if it's infecting a young person or an older person. It just infects whoever is nearby. So.
Right. Another school question. What needs to be considered in school openings for children who are bused?
Okay. Want to do that?
Yeah, so anytime you get in any close quarter situation, as much distance as possible is what we're looking for. And obviously we need everybody masked as long as it's tolerable. You're gonna have younger children as much as possible if they can tolerate it. We're going to be looking for that. It's actually required now for anybody. I believe the age is 4 and above. Mm-hmm. It's required, and then for,
I don't think they're going to let kids on the bus without a mask.
Yeah,
is what I'm thinking.
And I think, you know, if able, it's not a requirement, but if able, they're going to try and skip every other seat. Now, that's not going to be possible in most places just because of the number of buses. But they're just going to try and socially distance them as much as possible. And that's the protection that they're going to do. And then after every trip, they're going to clean the buses and then put them back in service. So as much as possible. They're going to do cleanliness. They're
Windows open?
Windows open. They're going to, even in the wintertime, they're going to crack the windows because we know airflow keeps the virus at bay as much as possible. They're going to clean the buses, and they're going to have everybody masked and social distance.
And hopefully we'll know who's sitting where.
Right.
Because if we do have a positive case that was on a bus, we're going to want to know who was closely, who was close to that individual. And again, when I say exposed, we use very specific criteria. It's not just anyone on the bus. It's somebody that's been within 6 feet of an identified case for more than 15 minutes. Now, obviously, you're going to be on the bus more than 15 minutes,
right.
but not every kid's going to be sitting within 6 feet of that individual.
Right.
Okay, so.
All right, next question. What have you recommended for school districts in fall sports?
Oh, the question is fall sports in school districts.
So
we're letting people who are smarter than me decide that.
Yeah, so obviously there's been a lot of conversation about school sports, especially since the Big Ten and the Pac-10 have canceled sports for the fall. So, as well as the NJCAA and and the MAC and some other people. So that is definitely a conversation. The MHSAA has said, for now, sports continue. So the high schools, or all the schools in St. Clair County, are continuing along that path. They're following the MHSAA, and until we know more, we're going to go along with that path. What they're doing right now, like football practice right now, is non-contact. They're doing it in groups of 6. They're doing social distancing as much as possible. Every day after practice, they are airing out the pads and disinfecting the not pads, but the helmets and any equipment. Volleyball practice is happening outside in groups of 6. They're wiping down all the balls when they're done with practice. Everybody's doing.
But let's put this in perspective.
Everybody's doing what they can.
We talked about my recommendation first, the epidemiology. When you look at the epidemiology, returning to in-person education, when we're at the level we are, is very explicit without extracurricular activities. So we're trying to get our kids back in an educational environment that's
right.
to their benefit, and limiting as much exposure to many people as we can, because each group they are subsequently engaged with is another group that could potentially be exposed and removed with a positive contact. So the less we mix our kids about, the more likely schools are going to be able to stay open. If you have a group of kids that are doing classroom here, and then they go and they do this after school, and then they're doing this after school, that all counts if there's a case. So we have to go all over the place. It's going to make things a lot more difficult if we have a lot of extracurricular stuff to do. Now, with that said, it's not going to be my decision to decide. We'll do the best we can with whatever decision comes down.
All right, next question. Where are the test sites for the drive-thru testing?
Drive-thru testing, which is going to go through August. The goal, of course, here, and I actually touched on one of the questions that goes on this, why vaccines are being offered at the same time. But what are we, the 13th? Today's Thursday, so starting Monday, we'll be at Algonac. Tuesday the 18th at East China. Thursday the 20th at Memphis. And then the following week, August 25th, St. Edwards on the Lake, and I believe August 26th is Port Huron. I don't know where in Port Huron. Do you know?
It's at the admin.
At the admin building. Okay. So those are the dates. You'll find the complete schedule on our website. We're testing from 3 till 7. We prefer an appointment. Drive-ups are welcome. Now, one person had called in and said, why are you offering immunizations? Because my child needs updates on immunizations, and I'm afraid to bring them to a COVID testing site. And the answer, quite honestly, is we want to provide as much service while we're in the location as we can. And immunization rates have really dropped since this whole COVID thing, because people are afraid to go out or for whatever reason. So we think it's really important to get, number one, we think it's really important to get your child up to date on immunizations. When you're coming into a COVID testing site, you're really not at risk. We're keeping you in your car. So you're in your own car. We are separating the two functionalities quite widely. You have different staff doing different things, and we don't believe that we're really exposing you in any way to more COVID. And I already mentioned that the vast people who are getting COVID tested are asymptomatic. In fact, the positivity rates we'll report on once we get those back next week.
Yeah,
I don't think we have those yet.
And I've been, other than today, I've been at every single one of those sites, and they're about as far away on the opposite ends of the parking lot as you can get. And the first day we had them in two separate sides of the buildings, right? We were outside, but they were, well, no, they were literally two different buildings almost.
Oh, okay.
So because we use the overhangs in the buildings to keep everybody out of the heat. So I assure you, there's as much safety built into the build-outs as possible.
Going anywhere.
Yeah,
as coming
going
here
anywhere.
or anywhere else. So.
There is a lot of safety built in. There should be almost no risk of COVID exposure any more than going somewhere and being at risk in the population.
Hopefully that answers your question.
Yeah.
Okay.
Next question. People with no symptoms, is the virus internally affecting organs?
The question is, are asymptomatic people or people with no symptoms, are they still in fact having
really
any
smart
physiological impact from the virus? And the answer is we don't know, although there is some preliminary data that suggests the answer might be yes. Okay? Just because you don't externally exhibit something, we do know that infections of many kinds can have detrimental impacts on our bodies. We're just learning more about that now. And obviously, you've looked at some of the research that shows some, for example, CAT scan abnormalities in people who did report no symptoms. So the answer is we have to still figure that out. More to learn.
That's a really smart question.
It is a smart question.
It's
a good question.
Question on your sheet. Justin.
Sure. So I'm going to go with question number 4 because we kind of jumped into the first two. But there's an article in the news today that Beaumont is restricting visitors because of increasing numbers. Are the numbers significantly increasing in neighboring communities? And I'm going to say yes.
Yeah.
So we know Macomb County is really struggling right now with getting their arms around what their numbers look like. And so, yes, we know that we are doing much better than Macomb County right now. And we're just keeping an eye on that. I will say that Oakland County is doing a little better than Macomb County. And Wayne County is a little bit in the middle, and that's okay. This thing is tricky, and we know that. So we are constantly monitoring between the health department staff and my staff. We are constantly monitoring what's going on in Region 1, and we're always able to report that information back to you all.
All right, last question. My physicians told me to get shingles vaccine, flu vaccine, and a pneumonia shot. Is this a lot possible COVID-19 vaccine?
The question is, if you're recommended to get multiple vaccines, is that too much for you to get while theoretically you would be exposed to COVID and your immune system needs to deal with that? And the answer is no. Vaccines have been studied extensively by themselves as well as with each other. Most vaccines can be given at the same time. Your doctor will know which ones can. And more importantly, we know that your immune system is very, very capable of managing those small antigenic challenges that are provided in a vaccine all at one time. In any given day, our bodies are bombarded with viruses and antigens and insults, and our bodies are more than adequately equipped to manage all of that. So what we get in a vaccine is tiny compared to what we experience on a daily basis, just breathing in air and eating our foods. So get those vaccines as your doctor recommended. It's a good idea. It's a good idea to get them as soon as you can, because we don't know how to predict, as obviously, this next wave and what's going to happen next.
All right, closing remarks.
Closing remarks already? Okay. Continue the good work. This is a difficult time, but at the same time, I'm really proud of the county. I'm really proud of the hard work everyone's doing. And we do need to step up out of our fear, out of our boxes. Doesn't mean we're just going to let all our guard down, but we do need to live our lives carefully, So when I say that, I'm saying, you know, if you really love the water, go to the beach and have a nice swim. You don't have to do float down. Okay? Think about that risk-benefit ratio and what you can do to still have, you know, a decent quality of life without really assuming all the risk of going into large crowds with multiple households in it. So let's do the right thing, and we'll be here next week. Thanks.
A couple of things I'd like to remind everybody of. Number one, there will be an end at some point to this in a large scale, okay? We may never get rid of coronavirus, COVID-19, but it will subside. You will at some point be able to take off the masks and begin to live what we remember as a normal life. Sports will return. All of these things will subside at some point. That is a fact, correct? Yes.
Yes.
So, until then, keep doing what you're doing. We know we've gotten to a point where you've figured out a way to get the transmission level back to a point where you can do things like potentially get kids back in school, at least for now. Okay, we are doing things right. Thank you for that. You figured out how to get through the turmoil with masks even a little bit. We're working through the things that we're asking you to do, social distancing, things like that. There were some hurdles and we figured that out. Thank you. So we'll see you next week. Keep fighting the good fight, and we're going to make this 1 week at a time, one step at a time, and we'll see you next time.
Bye.